What is the reinfusion process of a patient's genetically engineered T cells?
So when you actually get the CAR T cells, I will say for myeloma right now, most patients are getting it in the hospital. Now there are some, so with cilta-cel, because the side effects sort of happen later, there are some patients that will get it outpatient and then be admitted 3, 4 days later because the toxicity happens a week later. But again, for most patients, it's in the hospital. And it's similar to the transplant in the sense that our cell therapy lab will bring the cells over, and then we all do a timeout, make sure they're your cells, right? Because they went somewhere else and now they're coming back. And so we make sure they're your cells, and you are in your bed, or if you're outpatient, in your room, and then we bring those cells in, and then we make sure they're yours. And you've gotten usually Benadryl or some type of pre-medication, no steroids. We avoid steroids, so they don't kill the CAR Ts, but usually Benadryl. So some people are sleepy already, but again, it's just an infusion that we do right in the hospital into your, usually, sometimes a port, sometimes a pick. Rarely do we do IVs just to make sure those cells can get through without causing problems. But usually it's the nurse that hooks up everything, and the doctor's in there. So we have to be in there to monitor and make sure you're okay. But we don't expect any side effects in those first couple of hours. Usually, this is just like a blood transfusion, but a lot less time. Most people, each institution is a little different, but we do for over 30 minutes, and then you're done. And in terms of when do the side effects start, it's different for different products. I'll say the earliest I've had a patient start getting CRS or cytokine release was within 2 hours of the infusion because they had so much myeloma that the cells just started working right away. But for ida-cel, we usually see it in 1 to 2 days is when we start seeing the fevers. And again, with cilta-cel, usually the median average time is about 7 days. So it's a different time period based on which product you're getting.
Where can patients get access to CAR T therapy?
Access is a big issue with CAR T as well, besides just the medical stuff that we need to make sure everything's okay. So most patients will have to go somewhere where they can do cell therapy. And there's over 200 hospitals in the US that can do that, but they have to be FACT accredited, meaning that we know they have rules and ways of how we conduct cell therapy because it's a biologic. We're taking something out, changing it, and then putting it back in. We have to make sure it's done in the most pristine, best way so that people don't get infections or other things that can happen. So those are major hospitals usually that do stem cell transplants. Likely are the ones who are more likely to be FACT accredited. So that's where you can go for a cell therapy like CAR T cells.